swaddled bath reproduces what the baby experienced in the womb. The containment in the fetal position and the sensation of being surrounded by water and floating weightlessly. Introducing Edouard, who was born at full term less than 12 hours ago after a difficult delivery that ended in a C-section. In spite of this, he is beautifully awake and attentive during his bath. He's the couple's first baby, and his father, Maxime, was eager to take part in this first bath, demonstrating some magnificent parenting skills. If your baby was born prematurely, please refer to Leaflet 1 for more specific information. Make sure you use a bathtub that's the right size for your baby. Some bathtubs come with a small support with a net to provide back support, and this also allows parents to wash their baby with both hands. The bath should be a relaxing and pleasant moment for you and your baby. Make sure you choose a time when he or she is calm and receptive. Before. Prepare the environment. Reduce exposure to light if possible so that it doesn't shine directly into your baby's eyes. Reduce noise to create a calm environment. Close the room door to avoid drafts. Set the room temperature between 22 and 24 degrees Celsius if possible. Prepare materials. Run warm water. Check the water temperature with your wrist or elbow. It should be around 37 degrees, the same as your body temperature. Bring blankets or warm towels if possible for when your baby comes out of the bath. This is optional. Have the following items on hand. A thin swaddling blanket. Muslin is ideal as it doesn't absorb a lot of water once in the bath. A pacifier to help your baby feel secure, provided breastfeeding is well established. If your baby was born prematurely, this is particularly important. Mild soap and shampoo, ideally fragrance-free. A soft cloth for washing the body. This is optional. Some parents choose to wash their baby with their hands. During. Lay your baby on the blanket while guiding him with your voice and trying to apply the soothing methods. This refers to leaflet number 6. Hands to mouth and holding are used with Edouard. In this case, Edouard was already undressed as he was skin to skin with his mother in the room. If you're in the neonatal unit, ask the nurse to help you undress your baby and remove wires, devices, and monitors. While the nurse is changing the diaper, the father helps her using soothing methods. She takes the opportunity to compliment the father's parenting skills and sensitivity to his son's needs. The nurse swaddles Edouard while his father takes the time to place his hands on him to secure him. With a few seconds delay, Edouard reacts when his father withdraws his hands to gently remove his hat. Seeing this, the nurse takes over to help Edouard not become too disorganized. The nurse lifts Edouard gently and carefully, placing one hand under his buttocks and the other behind his back and head. A hand placed behind the neck may cause the head to move backwards, which should be avoided. If your baby is premature, we refer you to leaflet number 7 on holding, as precautions must be taken when moving your baby. The nurse gently places Edouard on the bath support, giving him time to acclimate. He reacts with a slight yawn, but brings his hands to his face to help himself stay organized. She guides him with her voice. The water is behind his neck and his head is well above the water. If there's no support in the bath, support his back with one hand to give him a sense of security. You can use a soft, wet, soap-free cloth to clean your baby's face and ears. The nurse begins the demonstration with Edouard's left arm, using a gentle, all-encompassing touch while avoiding light stroking. She takes the opportunity to soap the neck area. She rinses with a cup, but you can rinse as you prefer. She covers the washed arm and lets the father do the other arm. In this way, every part of the body is covered once washed, while keeping the baby tucked and organized. The father washes Edouard's legs while talking to him. Time and again, Edouard looks in his father's direction. These moments are precious, even if they can often go unnoticed. As for the nurse, she encourages both baby and father in this new care. Even if we don't show you the pictures, the genitals need to be washed. For baby girls, it's important to wash the vulva from front to back to avoid contamination by stool. To wash his back, the nurse and father turn Edouard slightly on his side, keeping him in the flexed position. The father placed soap in the palm of his hand and applied it directly to the blanket. He lathers up, then rinses. The swaddling cloth is gently removed while the father places the towel under Edouard's chin for his exit from the bath. The towel placed on his chest allows for better transfer and maximum envelopment. For the exit, the nurse tries to keep him in a flexed position as much as possible so that he doesn't become too disorganized. If necessary, finish the bath with a shampoo. In this case, the nurse washes Edouard's hair while he's already out of the bath. She guides him with her voice, explaining what she's doing. However, this can also be done at the very end of the bath while the baby is still in the tub. The nurse goes very gently since Edouard has had a difficult birth and his head seems sensitive. After the head wash, curled up in his father's arms, Edouard is dry and a hat has been put on his head to prevent heat loss. Calming methods may be necessary at this stage. After, put a diaper on your baby and dress him or her. If your baby was born prematurely, it may be necessary to apply other soothing methods for the next few minutes to give him or her a time to reorganize and gently fall asleep.